Good evening, everybody, or good afternoon, or good morning, wherever you are. So before we begin, I would like to acknowledge the tragic and brutal attack against the Jewish Shabbat community that took place in Bondi Beach in Australia. Those innocent lives were lost simply because who they were. This act of hatred is painful and deeply disturbing. It's disturbing us all. At a moment like this, it is more important than ever to stand together as a community against anti-Semitism and against violence and for humanity and dignity. And we all have to unite it together. So this Alpha Omega platform is really essential and important for us as a community. So our thoughts are within the victims, their families, and the entire Jewish community. And this is deeply disturbing us all. And I hope we all stay together, united, and hopefully that will come to an end someday. And with this note, I would like to say and welcome to our friend and our loyal community member, Dr. Nevin Zaboltsky, that giving us this lecture from USA now.
Yep.
Yes. Let me
Vermont.
say some words about Nevin. So Dr. Zabolsky received his dental and postgraduate degree in periodontology from the Tufts School of Dental Medicine. He has lectured throughout the US and internationally on tobacco-related issues. He has lectured and written courses for the American Dental Association and developed a curriculum covering all things related to tobacco and nicotine usage for Nova Southern University School of Dental Medicine, integrating it with their School of Medicine. He has authored a chapter on tobacco and oral health and tobacco cessation in the periodontal textbook Non-Surgical Control of Periodontal Diseases, and has recently written a chapter for the American Academy of Development Medicine and Dentistry on nicotine and tobacco-related issues that can offer curriculum options for medical and dental schools. He received the Vermont Advocate of the Year award from the American Cancer Society and a Lifetime Achievement Award for the Vermont Special Olympics after 40 years of service, and recently given their Golisano Health Leadership Award. I hope I pronounced it okay.
As good as I would.
Okay. He continues serving those with intellectual disabilities in various capacities. He is now entering his 50th year teaching and consulting at the Nova Southern University School of Dental Medicine and School of Medicine. You know what I want to say, Nevin?
What?
Amazing.
Wow.
What a curriculum. Amazing.
The
And that
amazing
you
part is I'm 77 years old this past week. That's amazing.
and that's amazing as well. And you look great, and
Oh,
your
thank you.
activity and your passion to the subject, your passion to
Yeah,
periodontology, your
yeah.
passion to dentistry, that makes it all. So
Well,
thank you
thank
very
you.
much. And the stage is yours. Thank you for giving us your time.
Oh, it's my pleasure. I feel like Don Quixote though, because the tobacco industries, well, we'll get into that as I discuss this. But okay, thank you so much for letting me be here. And I share the thoughts you had about what happened in Australia. I actually once was in Bondi Beach, so at least the sad part is I know exactly where it is. And they don't even have a large gun, people with guns in Australia. But with hate is hate. That's the saddest part of all. But anyway, we'll now switch to this, some of which this isn't always the most pleasant thing to talk about either. But let's start. So why are we bothering to even talk about this? So I'm going to make it personal. I can't see you, but I've given enough of these and seen what the audience says. But so the first thing I have as a question to you is how many of you know someone who has or has died from cancer? And you can see each other maybe, but I bet you're all raising your hands. And what if you could have prevented them from ever getting it in the first place? Wouldn't that be a lovely thing and a mitzvah to do?
You know, if you were to follow a busy doctor as he makes his daily round of calls, you'd find yourself having a mighty busy time keeping up with him. Time out for many men of medicine usually means just long enough to enjoy a cigarette. And because they know what a pleasure it is to smoke a mild, good-tasting cigarette, they're particular about the brand they choose. In a repeated national survey, doctors in all branches of medicine, doctors in all parts of the country were asked, "What cigarette do you smoke, doctor?" Once again, the brand named most was Camel. Yes, according to this repeated nationwide survey, more doctors smoke Camels than any other cigarette. Why not change to Camels for the next 30 days and see what a difference it makes in your smoking enjoyment? See how...
Now that was from the 1950s in the United States. That ad actually did run. And this is also from the 1950s. And you see, they're basically saying that dentists are recommending using Viceroy cigarettes. So we've come a long way. There is tons of tobacco products out there. We keep on getting new ones. Supposedly, they are going to make it easier for people to quit smoking, or if they're not quitting smoking cigarettes, they will switch. We'll talk about that later, but this is a whole slew of them, and we'll go over that quickly. As far as prevalence goes, and I tried to get this related to those of you in Europe and in Israel and the rest of the world. So the WHO European region, believe it or not, has the highest rate of tobacco use in the world, and it's projected to hold that position for years to come. As far as in adolescent usage, ages 13 to 15, which is really young, 4 million kids. And that, ironically, that 11.6, that's what the adult usage of cigarettes is now in the United States. EU has the world's highest adolescent cigarette smoking prevalence. And these are recent, so I did the research for this. As far as adult e-cigarettes, 4.6% more than double the global average. Vaping rates, ages 13 to 15, 14.3% use e-cigarettes, and that's the highest in the world. And adolescents are 3 times more likely to use e-cigarettes than adults. That's true in the United States as well. But there is some progress. So tobacco use now has dropped from 50% in 2000 in the European region to 30.8%. And as far as women, it went from 22.3% to 17.4%. As far as Israel goes, well, this is now June of 2025. That's the latest I could get. Health Ministry report revealed that 1 in 5 adult Israelis smoke, and twice as many are in the Arab community. And it's estimated that in 2025, you'll probably lose 8,000 people because of them using tobacco products. Almost 85,000 Israelis vape. 18% are aged 16 to 24, and that's prior to the conflict that you're going through, sadly, now. 53% of them, the first tobacco product they try is an electronic cigarette. As far as flavored tobacco, various different products, 88% of hookahs are using flavored tobacco, 82% for electronic cigarettes, and 45% for regular cigarettes and rolling tobacco. So what are the dangerous things in these products? Well, you have advanced glycation end products, and they're released when they're curing the tobacco, and that can cause cardiovascular disease and cancer. You have polycyclic aromatic hydrocarbons, and when they have fire curing of the tobacco leaves in one of these little sheds, and some of them are bigger, they can cause cancer. And finally, tobacco-specific nitrosamines, and that's again part of the aging process, gets incorporated into the tobacco, and that's implicated in lung cancer, pancreatic cancer, esophageal cancer, and oral and head and neck cancer. So let's talk about nicotine. It's not a benign substance, although if you listen to certain industries, they make it sound like it's benign. But here's all the side effects of nicotine. If you look on the left, you get the blood, and I'm not going to go through all of this because we don't have enough time, but you can see it affects all systems: blood, lungs, muscular, gastrointestinal, joints, central nervous system, heart, and also endocrine with insulin and diabetes. So it's affecting a lot of things. It's not a benign drug. It occurs naturally as a base. In the 1960s, what happened with the Philip Morris scientists and chemists, they added ammonia and they changed the molecule of nicotine. And what it did is it made it more basic and it made it more lipid soluble. And that made it easier to be absorbed into the lungs and also to go through the blood-brain barrier. And cigarettes and most e-liquids use free-base nicotine. And the bad thing about this is that, and you'll see how they modified it, is when you breathe this in and you get it down your throat and in your mouth, it's harsh because this type of nicotine is harsh. So kids would use it and they might get turned off right away because they didn't like the feeling of using it. But what happened in 2007 is the scientists and chemists at Juul Labs, what they did is they added benzoic acid to the molecule, and that made it less irritating to the throat, made it more biologically acceptable, and again, made it go through the blood-brain barrier quicker. So now kids like the taste, like the smell, and it doesn't hurt their throats, so they can use it. And then they can get addicted because they have no clue that it's addictive. Well, this is a cross-section of a brain, and what happens, this is where the nicotine receptor sites are. And you can see the ventral tegmental areas where those receptor sites are, the nicotinic receptor sites. You get conduction through there down to the nucleus accumbens, and that's where dopamine's released, and that makes you feel good. And that's the only reason that people even use these products, because it makes them feel good. And these numbers are important. I'm going to emphasize that. So if you smoke a cigarette, you get about 1.5 milligrams of nicotine that affect you. They say that if you have 4 to 6 milligrams, then you can become addicted, and that's like 5 cigarettes. This is an important number to keep track of. What happened with Juul is it now gets absorbed so nicely, it almost mimics how quick you get the effect into your brain as a cigarette. Now, nicotine is as addictive as heroin and cocaine. Whenever I say this, people think it's hyperbole, that I'm exaggerating, but it is true. So, big argument. If you speak to people who do tobacco harm reduction, their argument is, well, nicotine doesn't cause cancer, and it's a lot safer than using cigarettes. Well, let's talk about that a little bit. I would have to say that yes, directly nicotine does not cause cancer. It's not cause and effect, as far as we know, and this may change. But nicotine stimulates angiogenesis, which is the formation of new blood vessels, and that supplies nutrients to tumors so they could grow faster and grow. It also promotes abnormal cell growth. And there's a suppressor, a cancer tumor suppressor, which is CHK2. And it compromises that suppressor, which diminishes our ability to fight off cancer. So yes, it is implicated on some level, and who knows, 5, 10, 15 years from now, we'll find out more, but I'll talk about that later. So now let's talk a little bit about cigarettes. So again, this is new for the World Health Organization. 1.3 billion people smoke cigarettes in the world, and that comes out to about 6.5 trillion cigarettes are smoked, and this number hasn't gotten better. 8 million people die every year from using tobacco products. I got these cartoons. There was an international anti-tobacco cartoon contest, and some of these are really brilliant. So, cigarette smoke, 7,000 chemicals in cigarette smoke. 80 of them are carcinogens. And it's like if you wanted to poison somebody, you'd use some of these: arsenic, strychnine, cyanide. That's what they used to use to kill people. And these are all in the cigarette smoke. Don't know if this is true, but and here's another one. Cigars. You probably know a lot of people who say they smoke one cigar a week or, they don't smoke them. Usually, most people don't smoke cigars every day, although some do. Well, here's an advertisement from the 50s on a healthy cigar, a health cigar, mellow oh well. So a cigar is dangerous. Well, yeah. All cigar smokers, whether they inhale or not, are exposed to smoke and its toxic and cancer-causing chemicals that can cause lip cancer, throat cancer, tongue cancer, and if you inhale it, obviously all the other things that go along with smoking. So I tried to see how prevalent cigar smoking was in Europe, and it's a niche market, about less than 1% of the market share of the tobacco industry. So a single smoking cigar, if you're in a room with somebody who's smoking a cigar and it's not ventilated, it's like you're breathing in 43 cigarettes that are being burned. So if you're ever in a room with somebody who's going to smoke a cigar, say, no, 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 you can't do that. You don't see these pipes. My father smoked a pipe and he gave me a pipe when I graduated college, but I couldn't smoke it because it irritated my throat. But you don't see those that much anymore. So, but you do know what hookah pipes are, probably most of you. And it's basically a water pipe. And the fallacy is that if you use this, it's going to filter out all the bad stuff. So you're not going to get harmed by it. Well, part of the problem is that's not true. So if you smoke for an hour a shisha or a hookah, that's like smoking 5 packs of cigarettes. That's how much you're going to get as far as all these dangerous products. Not to mention if you share the tip, you can get herpes and you can get all kinds of diseases just from that. You can get hepatitis if somebody has a wound. So I looked up to see, so how prevalent is it? Well, it's the last thing I read in recent years. It says hookah has experienced a surge in popularity across Europe, the UK, and North America. Smokeless tobacco. Well, it comes in different forms. It comes as snuff or snus or chewing tobacco, and we'll talk a little bit about that. There's 3,000 chemicals in smokeless tobacco, and 28 are known carcinogens. Some of them, again, arsenic, cyanide. Polonium-210 is actually in the soil, and that gets incorporated into the tobacco roots, and that's where you get that, believe it or not. And that comes from nuclear waste. So what is snuff? Well, it's finely ground, moist, fire-cured tobacco. Comes in a pouch. Um, and interesting because you see these little pouches, you stick it between your gum and your cheek, and it's at an alkaline pH, so it's easily absorbed into the bloodstream. What is snus? Well, the word snus is basically the word for snuff. And that the good news is that it's steam pasteurized, um, and it has less nitrosamines. And you take that and you put it between your gum and your cheek and you leave it there. And then you get that absorbed into your bloodstream through your own mucosa, and that gets to your brain eventually. They put sugar in chewing or spit tobacco, and that's a problem, as you'll see some pictures. Um, and clearly, chewing tobacco is associated with oral cancer, but we'll talk about that. Silica is put in there also. It abrades the inside of your mucosa, and therefore it gets absorbed into your bloodstream more readily. Chewing tobacco can cause leukoplakia, and here's the thing about leukoplakia. You don't know how long it's going to take before it becomes a malignancy or squamous cell carcinoma, and you don't even know what part of that leukoplakic area is going to change. So this is a person who chewed tobacco. You can almost tell where. In the upper right side, that's where they placed it. And then you can see with time they have periodontal disease, gait recession, interproximal spaces increase, and it's a perfect trap for this disgusting chewing tobacco. Okay, electronic cigarettes. Um, let's talk about that. So Herbert Gill, he never gets credit for this. You'll see who does on Lick, but anyway, this is the United States, 1963. That's the patent below his picture, and that was when the first e-cigarettes were developed. So Han Lick, he's Chinese. 2003, he's a pharmacist. He and his father both smoke. His father dies of lung cancer, and he's trying to figure out a safer way to have nicotine. So he develops the e-cigarette, and that's pretty much the kind of cigarette that we see, e-cigarette that we see now. What is it? It's a battery-powered nicotine delivery system, and that produces aerosol instead of smoke. About 15,000 e-cigarette flavors, and I think that number is probably going up. And there are chemicals in there that are harmful. And most recently, you have nicotine pouches. I'm going to dwell on this a little bit um, because this is becoming a problem. They're pre-packed portions of nicotine salts and are tobacco leaf-free. So the argument is, well, this isn't tobacco. It's not tobacco at all. It's synthetic, pretty much synthetic nicotine that they developed in a lab. So therefore, it's safer. And I'm not going to say it's safe, and nobody really says it's safe. It's safer is the argument. Well, non-tobacco nicotine is basically that's how they're describing it did not come from a tobacco plant. It was made in the lab. And it's not the exact molecule as nicotine, so we don't know really the long-term effects of that either. This is still all of this is in its infancy. What do? You put it in your mouth and you leave it there, and people can leave it there all day. And you'll see they can use multiple pouches. So this is important. The average user consumes a half a can per day, which could be 8 to 12 nicotine pouches. So that's staying there in their mouth for long periods of time. And they can have anywhere from 3 to 30 milligrams per pouch. And you saw I said 1.5 milligrams in one cigarette. So that equals 1 to 3 packs of cigarettes a day. And that depends on how many milligrams of nicotine are in each pouch. Well, there are places in Europe where they're selling pouches that have 150 milligrams in one pouch. One pouch. So multiply that by a half a can. Well, so what does the FDA say about that? Well, it's not, they don't think that it's necessarily means it's safe, nor they think that that they're approving it, but not as a cessation aid, and they're not saying it's safe. It has a modified risk, whatever that's supposed to mean. And there's no data to show nicotine pouches as a safe or effective way to quit. So let's talk about Zyn. That's the main one, and that they Swedish Match. Basically Philip Morris International bought the company. Um, well, this is last year, and I'm sure the number's going to be higher. They're projecting that they're going to make $5.39 billion worldwide in revenue with this, and it's growing. This is something that's growing and growing. Tried to find out information about pouches in the UK and Europe. In the UK, they're legal, but they're treated as general consumer products. Um, and France, Germany, Belgium, and the Netherlands have banned them, and Switzerland has allowed it. And this is pretty much in its infancy, nicotine pouches, and they're not be confused with nicotine lozenges, and they're not to be confused with nicotine patches that you wear on your arm as far as delivering nicotine. That's different. That's a whole other conversation. So what's the prevalence? Well, the prevalence of adult ever and current use has doubled from 2020 to 2024, and that's reaching about 5.4% of Britons. And as far as kids go, 3.3% reported ever use, and that included 1.2% reporting current use. And in Israel, so nicotine pouches are legal in Israel, but they're regulated through the age restrictions, so you can't use them before you're 18. You see that they limit use of it in public and in marketing, and there are marketing restrictions. There are no flavor and nicotine content restrictions, so you can have 150 milligram pouches. But they do put health warnings on the packaging. Heat not burn products. Well, here's the discussion about heat not burn products. First, there's trying to simulate smoking cigarettes. That's that's what all of this is, because you're dealing with people who are smoking cigarettes and you try to get them to stop using it and supposedly making something that's safer. So the main one is IQOS. IQOS is a Philip Morris International product. They developed it in Japan, actually. That's where they did their test marketing. And the discussion is that it heats the tobacco, it heats this, and this is tobacco. These are tobacco sticks. And it heats the tobacco to 350 degrees Fahrenheit. And you could have menthol flavors. Unfortunately, that kids like menthol flavors. But the argument is if you heat it to 350, it's not dangerous. Or it's not as dangerous. They don't say it's not dangerous. They just say it's not as dangerous. MD Anderson Cancer Center is a very renowned cancer center in Texas, and this is their comment on that. Cancer-causing chemicals released in the aerosol from an IQOS device are the same as those found in cigarettes. Some are even found at higher levels, while others are at lower levels. So the bottom line is, it is tobacco, and if that element heats more, and they found some of these elements go beyond 350, so it's almost combusting it, that negates the whole point in saying that it's harm reduction. So, what does the FDA have to say about it? Well, they haven't approved IQOS as an effective tool for smoking cessation, nor has it said that it is safe. But it's on the market. And that again now generates over $10 billion in annual net revenues, and it's available in 70 markets worldwide, and 30.8 million adults use it. So it's pretty prevalent. Okay, it's currently marketed in more than 70 countries. And again, the FDA, this is the United States, says these products are not safe and denied PMI's request to market it as a reduced risk. So the bottom line is it's available, and it's well, I discussed this a little bit at the end. So now let's discuss more stuff. So how does it affect overall health, and how does it affect the mouth? Well, here's a Surgeon General's report, and they're discussing all these things. You can see on the left, those are all the cancers, including oral cancer, that smoking causes. And I think you probably know all of this already. Maybe you don't realize that the leading cause of bladder cancer is smoking cigarettes, but you can see it affects most body parts. And cancer is a terrible disease, terrible disease. And if you look on the right side, you can see all these chronic diseases are caused by smoking. And so you get people who can live 20 years or 5 years or 10 years or 1 year, depending on the cancer, but those are debilitating chronic diseases. Let's talk about oral health.
Pack of cigarettes, please. It's not enough. What's a pack of smokes cost? Your teeth. Smoking can cause serious gum disease that makes you more likely to lose them. See you again. What are cigarettes costing you?
So, as far as patients come in and they brush and they floss and they still can't understand why they have periodontal disease and it's not getting better, it's because they smoke or they're using these other products. Well, smoking causes cleft lip and palate when the infant is developing in utero, dental caries, periodontal disease, leukoplakia, oral cancer, vaping, and oral disease. Well, it can cause periodontal disease, dental caries, xerostomia, irritate the mouth and the throat, changes the oral microbiome, and also possible leukoplakia and oral cancer risk. And these are pictures that I gathered of cases of people who vaped and and periodontal issues and leukoplakia. So nicotine pouches can cause leukoplakia, and I'll show you evidence of it. And obviously, leukoplakia, as I discussed before, can become malignant and be squamous cell carcinoma. So here's the first case. If I asked you, what would you do? Well, if that doesn't go away, you'd biopsy it. And that's leukoplakia. Maybe, maybe not. And this is a case where he's 28 years old and he's used pouches for 7 years and he uses 5 to 10 pouches a day. And I told you how much that's, so that's 10.9 milligrams for each pouch. So that's a lot of stuff. That's a lot of, over 100 milligrams of nicotine. And the thing is, if you, and I've said this before, but if you're gonna see leukoplakia, you got to monitor it. You got to biopsy it. And these, even though they're using a pouch, they have to understand that there's still a potential, still a potential. This is still early in the game. We don't know how long it's going to take for these things to change. This is the second case. Again, you can see changes. And this person's 32 years old, and they've been doing 5 years, 5 to 7 pouches a day. And that's not uncommon for doing a lot of pouches in a day. So it can cause mechanical irritation. It can lead to inflammation and recession. And again, it constricts blood vessels, nicotine. So you're getting less blood flow and oxygen to the gingiva, and you don't heal as well. Changes the oral microbiome. So therefore you have different bacteria living there and potentially increase in caries. And again, if you're getting recession, your roots are more vulnerable to decay as well. Oral cancer. This is the worst of, obviously, of everything.
Smoking causes mouth cancer. If it didn't, I wouldn't be needing radiotherapy and chemotherapy. If looking at mouth cancer on your cigarettes makes you uncomfortable, look at another part of the pack.
This is Australia, by the way.
Quitting is hard. Not quitting is harder.
None of the things which have been found in tobacco smoke are concentrations which can be considered harmful.
But the components themselves can be considered harmful, can they not?
Anything can be considered harmful. Applesauce is harmful if you get too much of it.
I don't think many people are dying from applesauce.
They're not eating that much.
People are smoking a lot of cigarettes.
Well, let me say it this way. The people who eat applesauce die. People who eat sugar die. The people who smoke cigarettes die. Does the fact that the people who smoke cigarettes die demonstrate that smoking is the cause?
How do you argue with that logic? Okay. Any form of tobacco use can increase the risk of developing head and neck cancer. And these are all, you probably know this already, as far as risk factors. 90% of people with oral cancer are tobacco users. 90%. Smokers is 6 times more likely than non-smokers to develop oral cancer. For heavy users, 30 times the risk of getting oral cancer. And the bad combo is if you are higher risk, you are higher risk, 80% higher risk if you consume large quantities of tobacco and alcohol combined. Let's talk about smokeless tobacco. Well, if you chew tobacco, you got a 50 times more likely chance of developing oral cancer. And now we're going to talk about Sean Marcy. He started using tobacco and chewing tobacco when he was 12. His mother was a nurse, and she said, you really shouldn't do this, whether you smoke or you don't smoke. And he ended up dying at 18. He died 18 months after he was diagnosed. That's what he looked like before, and that's what he looked like when he was dying. And his friends convinced him that they should take a picture of him so it might scare kids from using it. And as I've said repeatedly now, only time will tell if e-cigarettes, nicotine pouches, heat not burn, or other new products will cause cancer. We just don't know. We just don't know. Let's talk a little bit about addiction. Now, this is a case, sadly, from Vermont. This is a woman who presented. I was given this, her niece gave me this. She gave me permission to use these. That's how she presented. It literally grew from the inside of her mouth through her cheek to the outside. So this had been going on for a while. That's the lateral border of her tongue and her cheek. That graft came from her arm. And she suffered miserably for 2 years and ended up dying 2 years later. Her husband watched her go through this, also smoked heavily. Cardiologist warned him that he was going to die if he didn't stop. He didn't stop and he ended up dying after having seen his wife do that. Shows you how strong this addiction is. And basically, is the continued compulsive use of a substance or a behavior despite harm to self and or others. And there's a physical component and there's a psychological component. And the combined together makes it so much harder for someone to stop smoking. That's why it's so hard. Physical addiction is to the substance itself. It changes your body, so it's harder to stop. And also you develop habits or mood altering behaviors. So you got to change your habits too, which is not, as you all know, whoops. And again, as I said before, dopamine's released in your brain. And that's why you do this in the first place, because it makes you feel good. And they use dopamine to measure any addictive potential of any behavior or drug. The higher the drug releases dopamine, the more addictive it is. And let's end with smoking cessation. So, what is the role of the dental professional? Well, again, I said what addiction is, and I said what that is. So, we're talking about oral cancer now. And as I was part of a symposium in Boston that was discussing oral cancer. Well, it decreased. This is healing now. So you've done this surgery, and it's not a very pretty surgery to do to remove oral cancer or head and neck cancer, but you're not going to heal as well, all because of the smoking. If you're still smoking after you have the surgery done. So ideally, they would like people to stop smoking and at least stop smoking 4 weeks before they have the surgery. But ideally, you'd want them to stop forever. So you have to take that into consideration. So cancer patient survivors are likely to be more dependent on a nicotine than the average smoker. They may require more intensive approaches, and that might involve multiple medications and counseling. 6% recurrence if someone is not smoking, and a 37% recurrence if they continue to smoke. So that's a big difference. Here's the challenge. That's what you can use as an assessment form for how addicted somebody is. And this is what the person wrote. I'm an intelligent college graduate. As such, I know that smoking is a filthy, dangerous, socially unacceptable, deleterious habit. I'm also aware that it is contributing to my gum problems. I do not smoke inside my home, in public, or at work. I'm aware of the different smoking aids. Please understand it was difficult for me to make this appointment due to my needle phobia. Being lectured about tobacco usage will not impart to me any new information, but it will simply make me angry and defensive. That was one of my patients, and she wrote this. She wrote a little essay instead of just answering that. So I'm going to close this with there's a thing called the tobacco endgame. And what it does, it bans sales of smoked tobacco products to anyone born, and it'll hopefully extend beyond smoked on it. So if you're born on a certain date, you cannot be sold tobacco. And believe it or not, the UK is on the verge of becoming the first country to implement a generational smoking ban. And you can see it pass the House of Commons. And basically, it's saying, I don't know if it'll happen, but that there'll be a smoke-free generation that's set to take effect on January 1st, 2027.
You do the same.
What did you do to my sign?
I wrote the same. Different words.
I wrote the same, but in different words.
Excellent.
So basically, what that is saying, I guess it's self-explanatory, that it's how you talk to people to get them to do what you want. And you can discuss a whole conversation on motivational interviewing, how you do that. But thank you for listening to me, and that's it. Please ask questions.
Just a moment. So thank you so much, Nevin, for everything. And
Thank
we
you.
wonder if there is any questions from the audience. There is one question. Oh, somebody came said that it's from Switzerland. Okay, that's good. And
I'll try to answer. I'll try to answer it.
You try to answer. Great. I'm just sitting. I have patient that I saw today that both of them are smoking. And one of my protocols, which is called the systemic phase, I always enter this time that the understanding of smoking for the help of the treatment plan and the success of the treatment plan.
Mhm.
It's always there. And as a the periodontist, you know that our treatment, surgical treatment especially, cannot be successful when they're continuing smoking. That's
Right,
impossible.
right. Not to
So this is
mention
one of my
implants.
conditions.
Not to mention
What?
implants. The success rate of implants goes down a lot if somebody smokes.
Absolutely. Absolutely. And this is one of my conditions. If somebody wants to have implants in my office or a recession coverage, they have to stop smoking.
Yeah, yeah, yeah.
I'm glad that I stayed and listened for the wonderful lecture because it's rarely that we have the topic on convention, and I think it's very important one. So really, thank you for the evening for the lecture,
My pleasure.
and I
Thank
hope
you
to
so
see
much.
all of you in about an hour on our council meeting afterwards. So maybe thank you very much.
Eldad, we have
Quick-
one question, Eldad.
and the certification, Jamie, Maisie, I forgot.
I will give him the certification, yes. And there is one question, Evan. Is
Go
there
ahead.
any research on the heat from cigarette melting composites?
Oh, you're talking about appetite and enamel?
I think about yes, yeah.
Well, actually, there are, excuse me, in vaping products, some of those vaping products actually compromise the enamel hardness, and they also create more of a biofilm. So yes, believe it or not, vaping can actually affect the hardness of the enamel.
Absolutely. And what smoking cessation programs do you suggest for patients?
Haha, that's great. That's a long answer. I think pretty much counseling and maybe using things like bupropion or Chantix, that's one, varenicline. Those are two actual chemicals, drugs that you can use, but you have to, the most successful are doing counseling and nicotine patches, or using those chemicals, those drugs as well. But counseling's really, really important. The least effective is cold turkey. That doesn't work. That doesn't work. As far as related to using, harm reduction products, the jury's the jury's not in on that. I don't. None of the big organizations support that, and I know in England they were pushing using that as harm reduction works. But I think if you're going to start thinking of using vaping as a product to stop people from smoking, you've got to regulate it. I think you need a prescription, and they have to see exactly what the patients are getting and controlling it that way. To just willy-nilly buy it on the market, or buying a pouch where you can get these absurd amounts of nicotine. Basically, what you're doing is you're just maintaining their drug addiction to nicotine. It's like having a heroin addict, using something as a substitute for that. So
Absolutely.
I
Yes,
so
that
that's, I guess my answer is, counseling, possible drugs, possible patch with the drugs. Um, I guess if they're desperate enough and you can't get them to stop, they could vape, but I certainly wouldn't recommend pouches. But even vaping, I'm suspicious of, and I wish that could be regulated.
that's
I worry
great. Yes,
mostly, to be honest with you, I really am pushing now about children and trying to protect children. And I don't think there's adequate protection from vaping for kids. I have a great video on that as well, but you got to protect kids from vaping, you got to protect them from pouches and cigarettes. They're not using cigarettes as much, but they're using these products, and then they go from that to cigarettes because they get used to being
yeah.
addicted to nicotine. So it's kids I worry about
I
the most. Yeah.
I agree. I agree completely. It's something that we need to control and absolutely make the awareness of the world about it. And Nevin, I want to thank you so much. I tried to share your certificate that we gave you, but I cannot I cannot share it, Eldad. I'm on the panelist, but I cannot share the stuff. But anyway, we will send it to you.
Oh, thanks.
And we
Thanks.
we would like to thank you very much, Nevin, for this important subject for all of us. And
And thank you for
hopefully
inviting me.
nicotine free, let's hope for in the next 10 years.
Yeah.
Good.
Well, have a nice Hanukkah.
Hanukkah